Hi, welcome to You Didn't Get the Memo. I'm your host, Gloria Bailey Ray. Guys, as always, we got a fantastic show for you today. We are talking about weight reduction. I have with me a world-renowned bariatric surgeon, Dr. Bmi Hanna, who is a fellow of the American College of Surgeons, and we're going to talk. And if you got questions, look, put it in the comments section. We will answer them for you. But again, I want to tell you, I'm Gloria Bailey Ray. I'm your host. And for those of you who are new to watching the show, and thank all of you for all of the questions and comments about what's going on with this particular show. But let me just tell you that You Didn't Get the Memo is really and truly about providing you, the viewer, with relevant and mainstream information to help you be informed, to make informed decisions. So without further ado, I want to tell you something about our guest, Dr. Bmi Hanna. Not only did I tell you he's internationally recognized as a bariatric surgeon, right? But he is also the founder and medical director of Las Vegas Bariatrics. He serves as the medical director for North Vista Hospital, Sunrise Hospital and Medical Center, and Dignity San Martin Hospital. Look, you think this man is busy? He's busy. Dr. Hanna has served as a trauma surgeon and assistant clinical professor and is a published medical researcher. Now, we're going to get into how and why he got into bariatric surgery, but I just want to tell you that Dr. Hanna has practiced in the Las Vegas Valley since 2000. Again, he's an award-winning surgeon. He's received top surgeon honors several years in a row and achieved the top doctor award for 2020 and multiple years before that. Dr. Hanna is highly skilled and known for his expertise in performing the vertical sleeve gastrectomy, the gastric bypass, the adjustable gastric band, some of you know it's the lap band, and weight loss surgery revisions. So without further ado, I want to bring in Dr. Hanna and say thank you so much for joining us. Welcome to You Didn't Get the Memo. I'm so excited to be able to have you on the show and for us to talk about bariatric surgery. How are you today?
I'm wonderful, Gloria. Thank you for having me. I'm very excited to talk about this topic because I just love weight loss. I love the topic of obesity. I'm passionate about what I do, and it's mainstream. A lot of people really struggle with their weight.
Right. And you know, that's a great segue into, let's talk about the one big common factor that you talk about what people struggle with, but obesity. We know that it's at an all-time high, and certainly the pandemic has not helped at all for people who have been quarantined. So let's just talk a little bit about obesity and obesity-related conditions. So, you know, obesity in our country, give us your take on that, because that will lead us into my question about why you really got into bariatric surgery.
Definitely. Obesity in our country is at an all-time high right now. Literally, obesity has skyrocketed in the past 10 years. If you look at the Centers for Disease Control site and you look up obesity trends, literally the past 10 years, it's skyrocketed. Our population is 2/3 either overweight or obese in the adult population. That's huge numbers. And when you look at the adolescent and younger school children, 1 out of 3 are either overweight or obese. So we're fighting a huge national problem. And you know, individuals who are fat, who are battling this issue, they really are up against the wall with trying to figure out how to lose weight with all the yo-yo dieting that's out there. And the success with yo-yo diets are not that great, which is why we're talking about what I do, you know.
Okay. And with that, you're absolutely right. In doing some research, I did go to the CDC website and I was blown away because the two most prevalent groups where obesity, you know, people are affected by this obesity. I want to call it, it's, you know, it's just this nasty little thing that we can't get rid of, was non-Hispanic Blacks and African Americans. And just what you said, even our young children they are so overweight. And you talked about it, fad diets. Why do you think diets don't work? I know I have my own opinion about it because I've tried a few. But I want to hear from you as the physician. Why is it that fad diets don't work? They make it seem like it's, it's so easy peasy. All you got to do is do this. So where's there that disconnect at?
There's so many diets out there, and there's not one diet that fits all.
Right.
There's short-term diet plans, regimens that obviously if you get on a regimen and you try to do something for 30 days, 90 days or whatever, at the end of that timeline, individuals go back to what they were doing before. So a diet is really what it says, a diet. But what we try to teach our clients at Las Vegas Bariatrics is a lifestyle. And we always teach them, weight loss is a journey. This is something that continues forever. So if you don't have the lifestyle part of it down, then you're set up for failure. Literally, medical weight loss programs fail 90 to 95% of the time. So if you have an individual doing a medical weight loss or a diet regimen, they do it for 30 days, 60 days, they lose 10, 15, 20 pounds, they stop the diet, what happens? They go back to doing what they were doing before. So if they didn't change the habits or the patterns that they were doing before, they just put the weight on and more. And especially now, you mentioned COVID at this time, Gloria, we have so many people calling us now because the struggle is real. The struggle is real. People are at home, people are not getting out, they're not active, they're not exercising. The meal plans are very different. And you mentioned the populations with Hispanic, African Americans, et cetera. You have individuals, and it's I hate to classify or put individuals in a certain population category, but when you're looking at financial struggles, you add financial struggles on top of that, and the affordability of good, healthy meals, it plays a huge role in what individuals struggle with, because the amount of processed foods and foods that are really not that healthy for us are the foods that are not, that are cheaper and are easier to attain. So these are the things that people struggle with with their obesity issues.
Right. You're absolutely right. But, and only because, as I was saying, when you do research, unfortunately, this is how we're classified on, on these websites and these type of thing. But what you're talking about is food justice too. When you think about, because one of the questions you kind of led into that, I was going to ask if you thought that the socioeconomic status plays a part in obesity. And in fact, it does. And when people can't get good food, I'm talking good food. And this is where I hope for parents that are listening, they have to understand, I'm still amazed at the number of children who don't like green vegetables. They don't, and the fast food. I know that fast food, parents, it seems like it's quicker and easier just to pull through the drive-through in McDonald's or whatever that chicken place is. People like to, it's great, and the mac and cheese. However, one of the things that we have to recognize and realize is that those basic things that we can tweak, it does make a difference. So we still have that imbalance as it relates to, where you live, what grocery markets or things are around there. And a lot of times in a lot of the neighborhoods that are depressed is the liquor store. And so they're not hardly trying to sell apples and oranges and, lettuce. So that definitely does make a difference. So thank you for weighing in on that and talking about why diets fail. But this leads me into the question that, as a surgeon, world-renowned trauma surgeon, why bariatric surgery?
Very interesting, isn't it? It's like looking at two sides of a coin. I finished my training, and I trained at Howard University in Washington, D.C. I did my surgery training there, and I feel like I got the best training on the planet because I had the best professors ever. I came to Las Vegas 20 years ago, and my first assignment and job was at the University Medical Center here. And I was a trauma attending there for 3 years, going on to 4 years. It was knife and gun club, blunt trauma. I saw everything, literally everything coming into trauma. It was high adrenaline rush, 12-hour shifts, either 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. You're there for 12 hours, just waiting for the pager to go off. And you have 3 minutes ETA, someone's coming in, emergency. So we're rushing people to surgery, saving lives. I had very happy patients, very satisfied patients. Patients were so grateful, saving their lives. So I did good. It was great. But my training at Howard was minimally invasive surgery, where we use small incisions to get into the abdominal cavity, and we operate technically skilled. But with trauma, we were in there, and you had to make an incision, and you got in and you dealt with it. So I was not using the skills that I learned to the fullest and to the potential that I really wanted to. So at the time, I started looking into bariatric surgery, because bariatric surgery was, at the forefront coming up about 20 years ago, and just becoming much more in the forefront of the surgeons, in front of us. But I thought this was interesting, and in doing my research, I started taking all the extra courses and stuff to do essentials and fundamentals and advanced laparoscopic skills courses for bariatrics per se. And I just slowly got into it. I found that this was a different arena because I still am able to save lives, but I save lives in a different way now. Trauma was all emergent. Bariatric surgery is all elective, which means that individuals come to me asking for help because they're overweight or obese, and they have health issues, diabetes, hypertension, sleep apnea, joint back pain. They have a lot of issues that's going on, and these issues affect their daily life. To lose weight, we can actually put these medical conditions into remission. So I saw that in helping individuals with bariatric surgery, I'm able to actually help individuals come off diabetes medication, come off high blood pressure medication. And once again, I have the happiest patients on the planet, I think, because they made a choice to come to me, and we make a choice together to help them through this. And we help them by teaching them a good lifestyle, by giving them a tool with the bariatric surgery. And it's just amazing to see the transformation. And another component to that, in my choice, as I always say, life is about choices.
Right.
Choice came about because, being in the trauma center, I have a wife at home, okay? And if I'm 12 hours, these long shifts overnight, I want to be home and spend time with my wife, spend time at home. There's a balance in a surgeon's lifestyle that, you really have to know and make the right choices in order to have a balanced life. And I chose this because it's all elective, and now I have a better life because I see my wife more. and my adrenaline rush is not like going nuts. My heart rate's not over 100 when I hear something coming into the emergency room. So it's just different in a much better way, Yeah.
Absolutely. It's about quality of life. I just know that the time that I spent, and when you're talking about working in the ED, it's crazy, right?
That's right.
And you're always on, right? It's always up here. It's never down here. It's always up here. And like
always there.
Those calls. So good for you for actually saying, hey, look, and you know what, trauma is not for everybody. What you're talking about, the skill sets that you have, minimally invasive type of skills, because back in the day all we knew is open them up, gut them, right?
Right.
And so you're predisposed to more infections and all these other things. So
Definitely.
I think that that's great, and that's why I love the idea of talking about bariatric surgery and how you do it. So as the comments are coming in, people are saying thank you for the information, and they appreciate saving lives in a different way. I mean, people are blowing you up, so that's a good thing. So look, let's talk about, you talked about the fact of what led you to make this lifestyle change, but at the same time, you know what, you have your own center of excellence, and it's a certified center for bariatric surgery. So I know that people are wanting to know what weight loss options are available, because that's how I type it. You know what? Hey, weight loss, you have options, right? And so
Sure
people
do.
are wanting to know what that is. So I'm just going to ask, because we got some comments coming in, but before I let you answer that, we're going to take a quick pause for the cause. We
Sure.
will be right back. So you guys don't go anywhere. I'm here with Dr. Bernie Hanna.
Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until Black lives matter.
All right. If you guys are just joining me, I am your host, Gloria Bailey Ray. You're tuned in to You Didn't Get the Memo. I have with me world-renowned bariatric surgeon, Dr. Bernie Hanna, who's out of Las Vegas, Nevada. And we're going to jump right in, because before we took that quick break, the question was, let's talk about what weight loss options are actually available to a patient. So I'm going to punt the ball to you and to say, okay, Dr. Hanna, let's start with whichever one you like to talk about, okay?
So, bariatric surgery has been around for 30, 40 years. And as the years have gone on, we have really modified procedures, we've modified techniques, but there are the more popular procedures that are out there. The main procedure that we do today is the gastric sleeve or sleeve gastrectomy. And I would say 90% of the procedures I do is the gastric sleeve. We've been doing the sleeve now for about 12, 13 years. And what it is a minimally invasive procedure where we go in and I remove a part of the stomach. So up to two-thirds of the stomach is actually removed. What remains is a stomach that looks like a small banana. In addition to removing a part of the stomach, we are also able to decrease ghrelin, which is the hunger hormone, so that individuals after the surgery have less appetite and less hunger. And you see here the sleeve gastrectomy in the middle, where that large part of the stomach is actually removed, and what's left on the left side is the small gastric sleeve. So individuals eat less. You eat about 1/3 less, and what comes with that is really lifestyle, healthy food choices, less calorie intake, and weight loss.
One question from a viewer, Dr. Hanna, while you're on that, is what role does psychological therapy play in the preparation of clients for this lifestyle changes, both pre and post surgery?
Oh, definitely. The psychological component is huge. It's actually a huge part of the program. For all Center of Excellence programs, we are actually required to have everyone undergo psychological testing, either with psychologists or a psychiatrist. So in our program, everyone gets a psychiatric evaluation. What this does is it just assesses an individual's readiness for surgery. We want to make sure that mentally they're there, mentally they're committed, and mentally they're ready to put in the work and move forward with a lifestyle change. So they're really screening out individuals who have major psychiatric issues that are untreated. What comes a lot with obesity is major depression. So we have a lot of depression in our business. So we want to make sure that depression is treated. Someone's on medication, they're being seen or counseled, so that after the change, after the surgery, after the weight loss, they're able to cope with the changes that's going to happen. Because if someone is 6 months out or 9 months out after the surgery, they're losing weight, they look great, they look fantastic. Now what? Now you're faced with dealing with society. Society has dealt with you in a different way prior to this. Now, 9 months later, a year later, society is looking at you differently. You're talking friends, loved ones, coworkers. So you have to know how to deal with all of these changes, how to deal with society, how to deal with people, how the comments will come. It's a huge thing also with couples, you know. You may have one individual who may have the surgery when the spouse is looking at the other in a very different way before surgery and after surgery. So the dynamics are very interesting, and it goes far and deep.
Yeah, I would imagine you touched on something in terms of how people, and this is so true, how our society treats people who are overweight versus how our society treats people who are what they perceive as that cover girl, playgirl kind of model figure. And we know that, at least I should say, I know that that's not realistic. And so, but once you lose the weight, what I found is people that I know that have had this particular surgery, instead of them just saying that I had the surgery, I hear them say, oh, I had a hernia removed. I had, they'll tell you everything except for what actually happened. And it's almost like there's some shame and embarrassment there. And that's what I was hoping that we would be able to dispel, that there is no shame in the fact that you want to get healthy. You don't want to die from a comorbid condition of heart disease, stroke, diabetes, all of these things. So am I on the right track?
Oh, you hit it with a nail right on the head. I mean, this truly goes deep, you know. There's stigma around this entire topic, and individuals look at it in very different ways. I have many clients, and I've been doing this now for going on 18 years, you know, after leaving trauma. As I segued into bariatrics, it's been now 18 years. So I've done 6, 7, 8,000 surgeries bariatric. And I have clients from literally all over the world and all walks of life. Okay.
Right.
And the difference, the things that you see is just so broad. I have spouses that have this surgery and they do not tell their spouse what they're having done. Okay.
Oh, wow.
I have you know, I've had patients that we do the workup for months, and I subsequently go to the operating theater and I do the surgery. And every time I do surgery, I always check, okay, who's in the waiting room for you? Who do I call to tell them how everything went? And one individual told me, well, my husband's out there, but don't tell him what you did. Just tell him I had a hernia surgery and I had stomach surgery for a hernia, and that's it. And I'm obligated to do what my client tells me due to HIPAA laws. I can't go out and tell anyone anything different. So, you know, I go out and I'm a bit nervous because now I'm literally lying to this man.
Right.
but I can't divulge that because it's not agreeable to the client. She didn't want him to know. And literally she went like that. 6 months into it, she's lost weight. And, you know, the subsequent follow-up visits, I'm saying, how's it going with the family? She said, it's going great. They think I'm just on a diet and I'm doing awesome. I'm like, well, good for you. But the one thing that you want to take away from this is, for weight loss and bariatric surgery, I always tell the individual, this has to come from you. It can't come from anyone else or anyone pushing you to do it. Yes. Although you may have people saying, look, you need to lose weight. You need to lose weight. Oh, you're overweight. no one wants to hear that, okay? They're sick of it. You want to be selfish in a way. You want to think about you. You want to think about what's good for you, because this is your health. You take ownership of your health and you make the choices that you need to make that's right for you. If you have diabetes, you have hypertension, no one's going to understand that as good as you understand it for yourself. So you make that decision and you do what's in your best interest so that you can get healthy. So these are the things that we teach our clients, and we would hope that your loved one, your spouse, your family are all on board. And for the most part, for most of all of our patients, that's the case, where family, friends, loved ones, they're all on board and they're all supporting them, because support is a huge, huge factor moving forward, not only before, but especially after surgery. It's a huge support system that one needs in order to help them get through that process moving forward.
Right. The comment line is blowing up. Okay. So, but I want to make this point. For people who are watching and looking at this, I can't say enough about the fact that you're just so authentic in saying, wow, that patient didn't realize what a predicament that they put you in, right? And I understand, doctor-patient,
relationship, privilege.
But at the same time, it is so unfair, and it's unfair to the family. But then you also said something else. When you've got everybody on board, it makes so much more of a difference.
It's so much easier.
Yeah. And I just hope people who are asking these questions that this belief is dispelled, that there is absolutely nothing wrong. And I know, look, this is kind of off the beating path, but I tell people one of the things for people of color, Black women, I should say, I grew up with, you don't have plastic surgery. You don't do things to your body. Look, I'm at that age where, look, I need my chest lifted, my stomach stable, and I need to lose a few more pounds. You hear me? And I'm not embarrassed or ashamed to say that, because it's all about how I feel about me and looking good.
It's your self-esteem.
For anybody else. Nobody else. It's about me. And it's about self-care for those people who are watching. They need to know that. So let me get to some of the questions that people have posed. Let me go up. Okay. Let's see, very informative. In a compliant patient, how long does it generally take for a post-op patient to get off of their diabetes medication? That's one, and then there's more to come. So let's answer those.
That's a quick answer. That could be immediate. Literally, I have hundreds of patients who leave the hospital literally never taking the diabetes medicine ever again. That's somebody who's like on metformin, on a pill or whatever. But it's a little skewed, because our patients immediately post-operative, they're on a liquid diet for an entire week. Clear liquid bariatric diet. You're talking sugar-free Jell-O, popsicles, Crystal Light, flavored waters, protein waters, everything sugar-free. So the blood sugar is going to drop anyway if you're on a low sugar liquid diet. Getting into phase 2 of the diet is a full liquid diet, which is creamy soups, pudding, yogurt, cottage cheese, this sort of stuff. So someone whose diabetes is just mild, they're on maybe one pill or two, right away, they may not need it. We tell them to check your blood sugar twice a day, make sure that it's okay before you take the medicine. And some just don't ever have to take it again. It's that fast. Insulin resistance changes quickly. And we have patients who are on insulins and stuff, months later coming off of their insulin and injections.
Yeah. And we all know that insulin is not a good thing. If you're on insulin, it is to me, it's just a horrible thing. Another question from a viewer. Does your program offer post-surgery therapy as well? I have met many people who have fallen into deep depression after their surgery because they couldn't reconcile themselves with their new body. And you kind of talked about that earlier, but does your program in particular offer any kind of post-surgery therapy?
In our program, we say we follow our patients for life, literally. Okay. So we have all the support systems in place to support whatever patient's needs are. We partner with a number of psychologists, psychiatrists, social workers, and counselors so that whatever needs to be addressed, we can hopefully steer people in the right direction. So yes, we do. And I think it's very important because a lot of individuals who've been overweight for 10 or 20 years even, I tell you, they lose weight and they walk in the office 9 months later and they look just amazing. And it's like, wow, you look great. It's like, but I still feel like I'm overweight. I still feel, and I look in the mirror and I see that. So it's really, really hard to see that, that disconnect and witness that when the reality is looking them in the face and like, you look great, you look amazing, So it just takes time for them to really get in touch with the reality of the change.
Mm-hmm. Yeah, absolutely. Another comment is someone said an assessment is very different from psychotherapy. People emotionally eat and often a reaction to historical trauma. Sounds like there's a lot of shame associated with this. Any thoughts on that?
Oh, definitely. Yes. We get that red flagged sometimes in our pre-op psych evals where clients have emotional trauma for whatever reason. When you're talking from child abuse, from sexual abuse to PTSD, from literally accidents and trauma, from death of a loved one or whatever, and they emotionally eat, they binge, all these things. So our psychiatrists, they actually recognize these things and they've set these individuals up for sessions, for counseling sessions and coping mechanisms and stuff like that. So we do see these sort of things.
Okay, definitely. Let me see if I can get to one last one. In fact, I'm going to read this. I think that it's going, people should know this. Someone just said that, hello, I'm so excited to say that I've been going to Las Vegas Bariatrics for the past few months. And although I haven't had the pleasure of meeting Dr. Hanna yet, he will be doing my gastric bypass. All right. Hello. Awesome. Congratulations. And thank you for sharing that with us.
That's cool.
Yeah, very cool. We have another question. What is the relapse rate?
Huge question.
Right.
So, typically, I talked about gastric sleeve, which is the most common procedure, right?
Right.
But we also have lap band, gastric banding. Gastric band has been around for many years. I put in hundreds and hundreds of bands. That's on the left. But the band has phased out. I haven't put a band in 4 years. We don't do it anymore. All I do is take bands out and we do revisions. And then you have the gastric bypass, which is the more extreme procedure where a part of the stomach is cut and then their intestines rerouted. So these work very differently, different mechanisms. One is restrictive, sleeve is restrictive, gastric bypass is a restrictive procedure, and it's malabsorption also. So depending on the procedure, there's a highest success rate based on the procedure that was done. But overall, anywhere from 60 to 80% of our clients should have good success with good weight loss and weight loss maintenance at 5 years. So this is how the ASMBS, which is the Society for Metabolic and Bariatric Surgeries, grades success after bariatric procedures. So when you're looking at that, you can have 10, 15, 20% of individuals coming back with weight loss over the subsequent years. But it far, far outweighs, the success of medical weight loss plans where you're talking 5, 10% success. It's totally the opposite.
Right. Right. Absolutely. Okay. You guys keep the questions coming in, but you know what? We're going to pause for the cause for just a moment and let you catch your breath there. You guys don't go anywhere. You've been watching You Didn't Get the Memo with Dr. Bmi Hanna, who is awesome. And we're so excited to have him here with us. So don't go anywhere, you guys. We'll be right back.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
you will see me.
As a son.
As a man with a never quit attitude.
As a fighter for change.
Join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
that has the power to make a big difference.
All right. If you guys are just tuning in, we are having a dope conversation with Dr. Bmi Hanna, who is a world-renowned bariatric surgeon. And Dr. Hanna, I didn't mention that you also have some roots in the Bahamas, too.
Oh, yeah.
I don't detect that accent yet, but okay. So let's get to some other questions, and people will come up with their own. But let's talk about the most common side effects that patients experience after weight loss surgery. What would you say are the most common things that you see?
So typically, right after weight loss surgery, the more common side effects are not really that serious. I know weight loss surgery in the past many years, 20, 30 years ago, had put fear in individuals based on bad outcomes that were started 30, 40 years ago when gastric bypass and stuff was being done. Over the years now, we've streamlined these procedures where they're safe, effective, and, literally the complication rates now are so few and far between. But more common side effects that we see are nausea right after surgery, dehydration, not able to drink enough because the stomach is small. So we encourage patients to just sip water and clear drinks slowly throughout the day, and not being able to get enough in. Fatigue, tired the first week because you're on a staged diet, the clear liquid bariatric diet. So the caloric intake is very low. You're talking 300-400 calories, 600 calories a day until the subsequent week when the diet is slowly then advanced and you're getting more calorie in, better nutrition, feeling better. But that's the most common thing we see is the nausea, the vomiting. There's always a chance of a small infection, but our incisions are really tiny. As you mentioned earlier, Gloria, this is minimally invasive surgery. We make really tiny incisions, 4 or 5 little incisions. A gastric sleeve surgery takes me literally 20, 25 minutes now. We have this down really streamlined to a science. Patients can go home literally the same day. This is outpatient. We do them outpatient at a surgery center. But for most insurances that require overnight stay in the hospital, but yet they're just overnight based on either the body mass index, the comorbidities or health issues, just for observation.
Mm-hmm. Yeah. Oh, wow. 25 minutes. I think back to years ago, and it just seemed like it was an eternity. But that's the difference where you're now able to do something microscopically as opposed to, like I said, just open you up and gut you.
It's very different.
Yeah. And in terms of infection, I think it's important for us both to underscore that, with anything that you do, there's a possibility of you getting an infection, but it is so minimal. Even now, and I'm certain with COVID, those you and your team take a major precautions with regards to that.
Oh, definitely. For us, especially with COVID and with the hospitals being inundated with bed capacity and, staffing. The hospitals are, the capacity is, some hospitals are at 100% with beds, units full, everything. So as for the elective procedures, they're really putting the brakes on us, and we're just doing very selective cases, taking to the hospital. We don't want to subject our clients to anything in the hospital, especially COVID. So for us, we take every precaution. All of our clients are COVID tested actually prior to their check-in. So we do a pre-op and check-in registration 2 to 3 days before. Everyone's COVID tested. So we know at least all our clients are safe coming into the facility. And, we work with the same teams all the time also. And we take all the precautions as far as the PPEs, the protective gear and the N95 masks and goggles and everything. So we want our clients to be safe. We want to be safe. We want our staff to be safe. So it's entirely a closed system,
Yeah, absolutely. Okay. Some more questions from the viewers. What makes a person eligible for surgical intervention? That's a great question.
It's an awesome question. Well, we always ask the clients, why'd you come to me?
Okay.
First, obviously you can't do it on your own. So you have to have failed with medical weight loss. So we want to see that you've tried weight loss, you've tried it on your own, you've tried diets, you've tried exercise, and you can't lose the weight and keep it off. That's one. So first is failure to do it on your own. And that's the one big stumbling block for some individual coming in, is that stigma where others may say, oh, you're trying to take the easy way out, you're trying to do this because it's easy, but it's not. Bariatric surgery, weight loss surgery is not easy. It takes a lot of work from that individual. So that's the first thing. Next is the criteria, pretty much the criteria based on Center of Excellence guidelines, ASMBS, which is the American Society for Metabolic and Bariatric Surgeons. So we use the BMI criteria, which is the body mass index criteria, where we take an individual's height, weight, we put it in this table, and this number comes out. If the number is less than 25, that's normal. Normal is under 25 BMI. Over 25 BMI is overweight. Now, to qualify for bariatric surgery, you have to be in the obese category, which is a body mass index of 30 or greater. If it's a lower end of the BMI spectrum, 30 to 39.9, you have to have a health issue in addition to that weight. So health issues such as diabetes, hypertension, sleep apnea, heart disease, or many of the other comorbidities that come along with obesity. If the body mass index is over 40, then some insurances don't require you to have a health issue. Just based on weight alone, you qualify.
Okay. And you actually answered, that was one of the questions. We're just delving into things.
Oh, yeah.
But that was one of the questions about the BMI and the waist circumference, because you see people and they have these huge, I mean, their girth is just really huge.
Oh, yeah.
And, how much did that play into what you look at in making that determination? You also already underscored the risk as it relates to if they have sleep apnea, if they are diabetic, if they have hypertension, stroke, heart disease, all of those things too. And for the people who are watching, they need to understand that sleep apnea is nothing to play with, right?
Oh, gee,
so, you're walking around, and because people tell you, girl, you look good in your clothes. And I just have to say this for those, wearing those, what are those things that women wear? Like the
dress.
Yeah, and I'm just like, oh my gosh, you can't even breathe. So, you want to do something where you feel comfortable, you feel good in your own skin, and the fact is that you're able to sleep, breathe easier without all of these other things. So, glad to hear you say that. Next question: what can a patient expect after weight loss surgery? And what I'm in particular asking is, like, will they have to take supplements? And how long before they can return to normal activities? Those kinds of things.
So it's a regimented follow through for success.
Okay.
Supplements, one. Everyone has to take supplements literally the rest of your life. So think about taking a Flintstone vitamin every day for the rest of your life.
Mm-hmm. Okay.
Bariatric vitamins. So bariatric vitamins are made for bariatric patients. We know that the bioavailability is there. You absorb them. The reason you have to take vitamins is because if I make the stomach smaller, so if I cut your stomach down to 1/3 the size, your absorption is less. You will absorb things differently. So everyone has to take a multivitamin with iron, with B12, so that you absorb things. So you have to be diligent taking your vitamins. We check our clients' labs on a regimented follow-up basis. The first year, every 3 months, second year, every 6 months, and then annual after that. We also have them following through with their primary doctors. So it's a marriage with the primary doc, the bariatric surgeon, and the client, so that we're taking care of you wholeheartedly. As far as going back to work, I typically tell our clients, take at least about a week off so that your energy level is back up, so that you can actually go to work, feel energized, and do what you need to do. Depending on the how strenuous your work is, you may need 2 weeks off. But typically most people in that second week, 7, 8, 9 days later, are able to go back to work when they start the full liquid diet. So they're getting in a little more nutrition. They're doing the protein shakes. They're getting in creamy soups and yogurt, stuff like that. So we do have a regimented follow-up. We see our clients either 1 or 2 weeks after the surgery, just to check wounds, incisions, all that stuff, make sure they're drinking and hydrating well. Then we see them a month later, 3 months later, and every 3 months for that first year. So we do have checks and balances to make sure that everyone is doing what they need to do.
Okay. All right. So what about a patient that's of childbearing age, though? If they have the surgery, will they still be able to get pregnant?
Definitely. It's one of the benefits of actually weight loss surgery, because individuals who are morbidly obese and are trying to get pregnant and have children, some suffer from PCOS, which is polycystic ovarian syndrome.
Right.
And these individuals have poor fertility and they just can't get pregnant. So we have a lot of patients who come for us as one of their major comorbidities when they're trying to lose weight, so that subsequently they can actually have children. And we have happy mothers now from having their surgery who never was able to get pregnant before, who now have their children. So fertility gets better. They're in a better position as far as health. So if someone is 300 pounds and they lose 100 pounds, we tell them wait. Typically the timeline to get pregnant after bariatric procedure is about 18 months, a year to a year and a half out. We tell them, look, don't get pregnant until you lose your weight and you're feeling great and you've plateaued, you're in a good place. And the fertility gets better. So they are actually able to get pregnant easier. They're in a healthier place. Their pregnancy is safer, because patients who are obese, having a baby, they're high-risk pregnancies. So now your risks have decreased, the risk of diabetes and stuff like that, preeclampsia, these things. So I think after bariatric surgery, all these things can be improved on.
Oh, awesome. We have another question. With the epidemic of pediatric obesity, is there an option in the pediatric population for doing any type of bariatric surgery?
There is, yes. There are pediatric surgeons that do bariatric procedures. I myself don't. I'm an adult bariatric surgeon, but my youngest client is 7. I've done some 17-year-olds, and typically it's 17, 18, where I allow them to make that decision with parents. For me, the choice is really making sure that this individual understands the implication of undergoing this procedure. They have to understand that their lifestyle has to change. They have to understand that they have to make healthy life choices as far as meal planning and eating the right stuff. They have to understand that, psychologically there's going to be changes going on. So I'm talking, I want to see a young adult who is an adult mind, who's really ready to do this and is fully committed to do what we need them to do. So it's a selective thing, when I interview younger individuals.
Yeah, but that's good to know that there are, pediatric surgeons out there that will do this particular procedure. So that's good to know. Let me just ask you this. Who should absolutely, and this is in caps, not have weight loss surgery? Because,
there is absolute.
So who should absolutely not have weight loss surgery?
The one that really, really is so high risk to undergo an general anesthetic, putting them on the table and not being able to wake up safely, that's who we will not do surgery on. So we're faced with this, all the time. I take clients on whose body mass index is in the lower range. I don't take on super obese clients. So if you're 500 pounds, I'd say the my heaviest client is probably about 460, 70 pounds or whatever. But when it's getting up there, the risks just skyrocket. So we want them to lose weight, get healthier. If you have bad heart disease, if you've had previous strokes, blood clots and blood thinners and stuff that, oh, gee, I don't know if putting you to sleep, you're going to wake up. However, I've done some very high risk patients, but based on the scenario, we get medical clearances from these individuals, doctors who are taking care of them. I operate a lot on individuals who have kidney failure, who are on dialysis, who have heart disease, who's had strokes, who's multiple medical problems. But we look at that individual and assess, okay, can we safely, and it's in a partnership with my anesthesiologist. I use the same anesthesiologist every time so that we know how we work together. So we look at it, we assess and say, can we put this patient to sleep and wake them up safely and get out of the OR safely? And if we can come up with a yes answer to that, then we will proceed. Because, for instance, patients who are on dialysis who need kidney transplants, they can't get a kidney transplant if their body mass index is over a certain number. So they come to us, do a bariatric procedure to lose weight, and now they can get their kidneys. I've done patients who have liver failure who need liver transplants and can't get on the liver transplant list. This is a very high risk patient. I've done some of them and they've gotten their liver transplants. So it's on a selective basis, but and that's on the surgeon to make that choice too.
Thank you for stating that, because I think that was very, very important that we underscore that particular piece. People need to also understand that. I'm going to ask you, I'm going to put up some pictures of some of your patients.
Oh, yeah.
Ask that you just kind of tell us a little bit about that.
Sure.
This is
that's Autumn. Autumn is amazing. You know, very energetic young lady who just was overweight her whole life. And, you know, someone who's going through the life in school, who's, you know, being bullied and teased and just needed change. See, this is a perfect candidate to just change a life and blossom. She did amazing. She had gastric bypass. She did amazing and lost a lot of weight and is doing awesome.
Yeah. Okay.
This is another amazing individual, Jasmine. Struggled a lot, you know, and when I look at her, I think about chicken wings because she loved chicken wings and she liked fried chicken and, you know, certain foods that typically, you know, African Americans eat. But changing her lifestyle and learning how to do it right, she was able to do that, following the rules. And she lost weight and she found a husband and got married. That's her in her wedding dress. And she sent me that picture and said, look, I got married, Dr. Hanna. It's awesome.
Oh, that is awesome. That's awesome.
Yeah.
And this last patient, this is the last picture that I have.
Yeah, that's Rana. She's another amazing success story. She just looks amazing. Sometimes I have patients, they walk into the office and I said, you know, some say I want to be a supermodel, but I say that's my supermodel right there.
Okay.
You're changing lives for the better, you know?
Absolutely. Absolutely. Dr. Hanna, first of all, let me just go back and just try to ask this one last question. And then I've got a question, a second question for you. And that is weight loss surgery covered by most insurances?
Yes, definitely. Most insurances now across the board cover it.
Okay.
We take pretty much all insurances. Literally in Las Vegas, just 1 or 2, 3 insurances don't cover it just yet.
Okay. Okay. Absolutely. All right. So as we wind this down, and this has been, I'm like, the time has flown by, but I want to ask you, what do you want viewers watching today's show to take away?
Well, you know, bariatric surgery has been around a long time, yet there are still a lot of people out there who feels that it's not safe. We have center of excellence programs, and this is all we do. So bariatric surgery is now safe. It's effective. It works. You don't have to feel like you're trying to cheat life in doing this. You're choosing life, okay? So don't feel bashful. Make the choice for yourself. It's safe. We also have patients that fly from out of state, from all over the world, and come to us because certain states and insurances don't cover it, so they don't have that access to bariatric surgery. We actually have patients flying in a day or two before. We have their surgery done and they fly back home 2 days later. So it's safe, effective, and it works. So even primary doctors, some primary doctors are not on board yet with bariatric surgery. They still tell patients, look, get on a diet and exercise. And I always say, you know, if it was that easy, we'd all be thin, okay? It's not. So education is key.
Yeah. Yeah, I always find that interesting when I go into the doctor and they say, Mrs. Ray, you're overweight, and the same thing, get on a diet. Well, first of all, when you just tell people to get on a diet, what does that mean? A diet of what?
What does it mean?
A diet of chips and dip, a diet of, I mean literally, and it's not like you don't have this entire holistic approach where you've got a dietitian on board, a nutritionist on board, you got a naturopathic and so it's amazing that and it's no wonder that so many people are confused. They have no idea, and then it doesn't help with society, everything out there. You can't go on Facebook, YouTube, Instagram, even TV commercials, and it's all these weight loss programs and all this, and so right now this whole thing, it's you get on and you just shake the weight off. I mean, really, if that's the case, everybody would be shaking, right? So it's just amazing.
If it's that easy, you hold that shaking, it's like, okay, let's do this.
Oh my gosh, yeah. So it's, to me, I think that what you've been able to do here today is to really shed a lot of light to a lot of people, because we still have a lot of people online. They didn't go away that are tuned into this, and I think that that's really great. And so I want to thank you so much for coming on, being here with us, and sharing what you know. What I also would like to do is I want to just put up your information so people who may want to contact you, you guys can do so. This is the information, I guess, if I take us out of the stream here, and they will be able to see it. But I just want to thank him so much for being here. Dr. Hanna, don't go anywhere. People are saying this is a very informative show and it's really great content. I do want to just ask you, what do you want these people who are here to just take away from what you said today?
Weight loss surgery, like I say, it's safe. If you're struggling with obesity, especially now during the pandemic, make the change. Make the choice. I always say life is about choices. Choose you and choose health. And it's a struggle. The struggle is real. We're here for you. We're compassionate. We're sensitive to your needs. We understand you. So call us. Call us at Las Vegas Bariatrics. We have a full team of individuals and bariatric coordinators just there waiting and working with you. It's a process. And the journey is lifelong. So we hope that we can help you, and we're there for you. So just reach out, and there's no commitment on your part. Knowledge is key. We're just here for information. You don't have to do anything. We just sit, we talk, and this can take months. The process can take 3, 4, 5, 6 months. So you don't have to commit.
Yeah, I think that that's really important because knowledge is power. And that's
Yes.
exactly what you've given people. And I can truly say, in talking with your staff, I'm thinking, wow, are these people like for real? Because they were so nice, accommodating, and so kind. And that's what you
Thank
get.
you.
And you gauge, the type of physician that you're working with by the staff. And so what an awesome staff. So I want to thank you
Thank
again
you.
so much for coming on, being here with us. Don't go anywhere. You guys, I want to thank you all for tuning in, for hanging in here with me. Love the comments. Thank you guys for all of your questions. We couldn't do this without you. And I just want to encourage all of you guys every Tuesday, 5 p.m. Pacific time. Be sure and tune in to You Didn't Get the Memo with me, your host, Gloria Bailey Ray. And I assure you, we will always bring you a show that is informational and educational. Until this time next week, be well. And remember this, the quality of your life is determined by the decisions that you make.